Every 10 minutes, 12 women in the United States undergo a hysterectomy. That's 600,000 a year. 1/3 of those are due to uterine fibroids. They can be painful and disruptive, and women now have another option, one that doesn't involve major surgery. Dr. Frank Cirasano joins me now from Boca Raton Regional Hospital, telling us much more about this. Thank you so much for joining us, Doctor.
Thank you, Mike.
Let's talk about uterine fibroids. Are they common in women?
Quite common. They occur in the uterine wall. They're typically benign tumors, and they can cause a lot of pain and discomfort and be prevalent in up to 50% of women by age 50 years.
Outstanding. And let's take that pain away from one. What are the treatment options here?
Well, classically, the majority of women undergo a hysterectomy procedure, and as you may understand, that involves a hospitalization as well as recovery, and the recovery times can be up to 4 to 6 weeks, which includes disability and missed time from work.
Yeah, that's not a good option there, but sometimes surgery can be avoided.
Yes. Now, a newer procedure called the MyoSure shaving device can be used to shave away the fibroid within the uterine wall without actually removing the uterus. Okay. And when we do this, we more or less smooth the contour of the cavity lining, and that reduces bleeding and pain and allows the patient to return to work the same day or the next day.
Yeah, we were talking about the time frame while we were chatting earlier, and this is a quick procedure.
When we go from doing a hysterectomy procedure, which involves hospitalization, to an outpatient procedure, such as using the MyoSure device, which we have here, we're able to reduce the procedure time to under 10 minutes.
Wow. And
patients can often go home the same day. Essentially, they can go home and even go to work. Wow. If they're comfortable enough. The device is shown here. It's a patented technology that is introduced to the uterine cavity, this 3mm probe, which has a shaving device at the tip. And when introduced under video guidance, the shaving device is activated to rotate. You can see it here. And when the shaving device rotates, it shaves away any irregularities inside the uterine cavity, which include fibroid tumors or polyps. And in this way, when we smooth out the cavity, bleeding and pain are reduced.
I think the one thing women want to know about when you're dealing with that particular area of the body is, you kill the tumor, are you going to kill the chances of having children later on?
This device is actually used as a therapeutic option for women that have infertility. So again, these are women that have trouble conceiving or getting pregnant because of the presence of polyps or uterine tumors like fibroids. So this option actually may improve fertility and improve a woman's chances of conceiving, and is used for women that have trouble having children because of fibroid tumors.
Doctor, very interesting. Thank you so much for joining us today. And Boca Raton Regional Hospital sponsors our Expert and Underwrites, our Ask the Doctor segment.